Greetings, health practitioners and all those interested in health. I am Chris. I'm a retired medical specialist, 40 years practice in a lot of areas of medicine. I say to people at the beginning of these videos that if you have any concerns about your treatment or diagnosis, you should take it up with your personal health practitioner. In the videos to date, we've been discussing a book by Professors Buckmeister and Harris, Hippocrasy, How Doctors Are Not Practicing According to Their Oath. And in that book they describe many treatments and surgeries that doctors undertake which are not in the interests of the patient. In the matter of exercise, in chapter 8 of that book, they discuss things that might be helpful in preventing chronic back pain. The only studies which appear to be worthwhile are those studies that involve some form of exercise. Elsewhere in the book, they tell of total knee or joint replacement surgery, and if patients are discharged immediately after this home to do their own exercise regimes, this is as effective as staying in hospital for a 10-day physiotherapy regime. The authors also discuss the fact that after bariatric or fat surgery, patients are successful if they keep up exercise and diet programs even after they've had the surgery. In our own practice, we found that patients who did not continue either diet or exercise, a third of them either did not lose the weight or regained the weight. When you tell patients over a certain age about exercise, their expressions change and they don't seem to like it. And they remind you of two characters in literature. The first character was in Marcel Proust's Remembrance of Things Past, Aunt Leonie, who never left her room and was haunted by nightmares that a deceased husband would come to visit her and tell her that he was taking her out for a walk the next morning. The other character is Oblomov by the Russian author Goncharov. He was terrified of exercise and never left his bed or went out or could make a decision. Today, as many as 80% of patients do not undertake the recommended regimes of exercise for their age. I'm about to tell you a remarkable story. A man came and saw me. He was aged 55, retired. He was overweight and he was very unhappy with his physical health. His body mass index was greater than 30. He had blood pressure, elevated blood pressure, and he took blood pressure tablets. His blood sugar was increasing and he was in the early stages of diabetes. Diabetes in later life is caused by the fact that the body no longer responds to insulin even though it's producing insulin. He did not sleep of a night time because he was troubled by chronic acid reflux, and he suffered from chronic knee and joint pain. When he told me he was unhappy with the state of his physical health and what might be done about it, I made the usual recommendations. Having reservations that doctors have, it will be difficult for the patient to follow these recommendations, and even if they follow these recommendations, it probably won't make a lot of difference. So I told him about the usual dietary restrictions and that he should exercise on a regular basis. How much, he said. The recommendations for his age were between 120 to 150 minutes of exercise, moderate exercise, per week. He seemed struck by this, and then he said to me, what if I was to undertake an exercise regime of between 120 and 150 minutes of intense exercise per day? I said, well, that would be a different matter. First of all, we'd have to check your heart out and not just an ECG, but would actually have to do a heart scan. We undertook the heart scan and he got a clearance, and then he began his regime. It took him about 3 months to reach the level of exercise he wanted to reach. 1 hour of intense exercise at either end of the day. Then something quite remarkable happened. At the end of this period, when he saw me, his pulse rate had fallen to between 50 and 60 beats per minute. That's athletic levels. And even with intense exercise, his pulse rate did not exceed 105. His weight began to fall because undertaking that level of exercise is not possible to be overweight. And his body mass index dropped below 25. His blood pressure began to fall, so his systolic blood pressure fell below 120 and his diastolic blood pressure fell below 80. His chronic reflux began to disappear, and because of the level of exercise he was taking, he was sleeping right through the night. Now the reason for this is, because he was undertaking such intense levels of exercise, his stomach would empty much more rapidly during the day. His blood sugar also began to reduce, and now there was no signs of diabetes because his insulin was able to function normally. I asked him about his back and knee pain. He told me that for the first 3 weeks his knee and back pain were almost unbearable, but he persisted, and at the end of the period they had disappeared completely. In fact, now he found exercise pleasurable. Has he found the fountain of youth? It certainly looks like it.